Family therapy, also called family intervention, is a psychological therapy for the treatment of schizophrenia. This therapy makes the assumption that schizophrenia is caused by socio-cultural factors, such as the role of family relationships. The schizophrenic symptoms are regarded as a response to the negative, hostile, and criticising family environments and dysfunctional patterns of family communication. For this reason, the therapy involves the whole family, not just the individual with the diagnosis of schizophrenia. The therapy can take place in the family home. Initial sessions aim to develop a trusting relationship with the family, and therapists work with the family to help them support the individual with the diagnosis in the best way. The family are educated about the disorder and they're given all the information they might need. The individual with the diagnosis is likely to be asked to talk about their own symptoms, such as hallucinations and delusions, and discuss them with the family, because after all, they are the expert in this situation. The whole family contribute to the therapy, and the aim is to develop coping skills. Family therapists also encourage discussion about day-to-day problems and how best to solve them. The therapist helps the family to learn more constructive forms of communication, like avoiding conflicting messages and reducing levels of expressed emotion. Families are encouraged to take each other's perspective in order to improve the way they communicate and the way they respond to each other's behaviour. A family who understands that their relative with schizophrenia might be staying in bed all day because of the effects of their medication or because they fear other people's reaction to their diagnosis are more likely to respond supportively and less likely to respond with anger or hostility. The family are also trained to recognise early signs of relapse so the individual can get the support they need from professionals as quickly as possible and to avoid a severe psychotic episode that might lead to rehospitalisation. A number of studies have shown that family therapy can be an effective way to treat schizophrenia or at least prevent relapse. Hoggerty, for example, found that after 2 years, only 29% of patients receiving family therapy had relapsed, whereas 62% of patients in a control group receiving only medication had relapsed and had been rehospitalised with schizophrenia. This study takes a scientific approach, randomly allocating participants to groups and employing a control group. However, this study doesn't show that family therapy can treat schizophrenia in the first instance. What it seems to do is provide an effective way to prevent relapse. Research shows that patients who return home to live in high expressed emotion households are 4 times more likely to relapse than those that don't. The success of this therapy implies that this is a credible explanation. Family therapy can be argued to be an ethical therapy because the family is taught to view the patient's symptoms as an understandable response to their environment. The patient's experience is destigmatised and the whole family is supported. This is in contrast to biological treatments, which have been viewed as methods of control rather than supportive therapies. As the therapy addresses the family dynamics, the therapist and the patient, however, could be perceived to be placing blame on the family. A skilled therapist who deals with the family in a sensitive way, however, may reduce the negative impact on the family. As this therapy gives the individual and their family long-term coping skills without simply masking the symptoms, family therapy can be argued to be highly appropriate in the management of schizophrenia as a way to prevent relapse. Family therapy might not actually be suitable for all patients, as not all people with schizophrenia come from dysfunctional family environments. And furthermore, some families, particularly those that are hostile, might be unwilling to engage in the therapy, especially if they think they're being blamed. Finally, it might also be the case that some patients are unable or unwilling to engage in the process and work with their families. This might be a particular problem where a family have been abusive to the individual in some way.